and when was that request made?
We've had extensive discussions with the FAA, and they made it clear that to shut down an airport is not possible. We've explored different options. Airlines cannot discriminate in who gets on an airplane. There are other administrative and other logistical challenges with directing only essential employees to be able to travel to Hawaii.
Okay, Governor, also this is from Max Dybel at Big Island Now. As part of an emergency proclamation, you suspended narcotics laws, allowing doctors to issue prescriptions to patients they've never examined via telehealth appointments. Why were medical marijuana certification processes not extended the same exemptions? And do you have any plans to address medical marijuana certification during this time of mandated social distancing?
You know, we will look at all the impacts of the actions taken and making adjustments to the emergency proclamations as necessary. Our focus was ensuring that we have the healthcare professionals here to be able to provide services to our community. We believe that telehealth would be an important asset that would allow us to protect not only our healthcare professionals, but also extend the reach of healthcare services into rural communities that may be challenged during these COVID-19 times. So that's the purpose. You know, we are looking at and evaluating all the actions necessary virtually every day to decide additional actions, proclamations, and executive orders that would allow us to keep our community safe and, most importantly, to flatten the curve and defeat this COVID-19 pandemic.
Governor, another question for you. This one from Rick Kwan, KITV4. Have you read the letter local mayors have sent to President Trump? And if so, what are your thoughts, and do you intend to support that measure?
Now, as I said before, I do believe that the 14-day mandatory quarantine can be a very effective way to keep travelers out of our community. We requiring a 14-day mandatory self-quarantine will assure that we discourage those who should not be here. I've had extensive discussions with the FAA and other federal officials, and that request would be very difficult to implement and impossible to enforce. So we are looking at real ways to keep our community safe. I would also like to note that yesterday we had 0 visitors coming from Japan. You know, I do believe that the mandatory quarantine is effective. We need to all work together, all the counties and the state, to enforce the implementation of the 14-day mandatory quarantine.
Thank you, Governor. Our next question is for Bruce Anderson, Director, Department of Health. Dr. Anderson, this is from Kristen Concilio at Star Advertiser. Ambulances responded this week to the Pride of America for possible COVID patients. How many people were on that ship and how many were positive, and where are they now?
I'm not familiar with the details there. I recall one crew member was identified as being positive and is in isolation. I would have to look into that and get back to Kristen.
Okay. Dr. Anderson, please stay there. You have a couple of more questions here. This is, hold on just a second, from Daryl Huff, HNN. With the additional cases added today, are you seeing any clusters or patterns, and will you start putting actual numbers by zip codes instead or along? Daryl, this isn't making sense here. Okay, so basically your question is, with the additional cases added today, are you seeing any clusters or patterns, and will you start using zip codes to inform the public?
We're actually using census tracts now. But first to his first question, we've seen situations where individuals in the same family have been infected. We've seen other situations where people have been in the same gathering and have been infected, probably by the same source. So we're seeing some clusters of illness, but it's only been in social settings or other settings where you would expect that to occur. So far, we haven't seen any widespread transmission within any particular community. The maps we published and are available now on our website show the census tracts of the individuals who are identified as confirmed cases. And if you look at those maps, you will see that there are more cases in some census tracts than others. The likelihood of those being associated with a common source is probably very small. In fact, if you note the numbers of cases, the higher numbers are typically associated with census tracts with high socioeconomic status, and probably are associated with travel. There's simply more people traveling and having that opportunity to be infected. As you may see on the spot map, the epidemic curve here, most of the illnesses we've seen in Hawaii have been associated with U.S. residents going to places with COVID-19 and being infected there, bringing the disease back with them and coming here. That's one of the reasons why the governor's restrictions on travel, I think, are so critically important.
Okay. Dr. Anderson, one more question. This is from Kehau Curzio from Maui News. Her question is, what is the state doing to assist Molokai, which doesn't have medical resources to sustain an outbreak, and how can residents of rural communities like Molokai and Hana that are more vulnerable take extra precautions?
Well, the precautions that we're recommending apply to everyone, even those in rural communities where physical distancing isn't as much an issue perhaps as urban areas, but certainly we'd encourage everyone to avoid being in close proximity with others. Even family members can be infected without knowing it. The neighbor islands, and particularly Molokai, is challenged because their health care system is not as well developed as others. They have an excellent hospital, but it simply doesn't have the resources available to it that we have here on Oahu. In fact, the case that was identified today was initially transferred from Molokai to Queens here, and is being treated here to be sure that that individual is getting the best care that's possible. That's one of the reasons why the medical exemption for the inter-island transport is so important. We recognize the need to be able to get residents who are in rural areas to the health care facilities that can properly support them. So my advice would be, of course, to continue to practice physical distancing, whether you're in a rural area or not. If you're ill, do see your physician, and even on the remote areas, the physicians can order the tests and have them done if they need to do that. So we're reaching out, and HAH, the Healthcare Association of Hawaii, is supporting all the hospitals around the state, including those in the rural areas.
Dr. Anderson, another question for you. This is from Wendy Osher, Maui Now. With 9 new cases on Maui, including the 2 in rural communities, is there any extra effort to conduct more testing, especially in these vulnerable locations?
We've actually, in our Sentinel surveillance program, where we're looking to see where the disease may be spreading, we've oversampled in some of those rural areas, like Molokai, on Lanai, and even in Hana, and some of the outlying areas on the Big Island, to be sure that we're not missing things that might be happening there. That's I think, very helpful in keeping track of what's going on there. I believe the mayor on Maui has actually restricted travel for even family members to Hana, which should also help to reduce the likelihood of someone bringing the virus with them, unintentionally, of course, to that community. So that area, at least, has been essentially our travel's been even more restricted in that area. So we're trying to do what we can to try to address the issues in those particular communities. I must say that as time goes on, we're going to be looking at very unique situations in Hawaii, and we're going to have to adjust our policies and maybe impose restrictions in other areas as well to be sure that the COVID-19 doesn't spread.
Dr. Anderson, this is from Manola Morales over at KHON. Do you know how many tests have been done on Molokai and Lanai?
Very few have been done by the private labs. We have sampled them through the Sentinel surveillance program. They are able to test for COVID-19. They send their samples to laboratories on Oahu, or in some cases even on the mainland. I can't tell you how many have been actually sent from those areas, but Obviously, there's been at least one, being that we did find a positive on Molokai. But we are able to do the testing from those remote locations.
Okay. Also, Dr. Anderson, Daryl Huff, HNN, asking you to please recap the details of the 3 deaths by age and gender, if possible.
You're challenging my memory, Daryl.
We can get that to him later if you'd like.
I think that'd be, in the interest of time, best to do. As far as I can remember, they were all Hawaii residents who had become ill, probably because of contact with travelers, with the exception of the one reported on Monday. She was a middle-aged lady who had no obvious travel history recently, but came down with COVID-19 symptoms and was hospitalized and had passed away 2 days ago. But the others did have a travel history and were probably infected where they were traveling.
Okay. Thank you very much, Dr. Anderson.
Okay.
General Hara, a question for you. Hold on, General. Let's see. There you are. Okay, so this is from Rick Kwan. 2 arrests have been made for breaking quarantine. Are you pleased with how enforcement is going?
Yes, I am pleased, but it's actually 3 arrests that have occurred. Is it?
Is that all?
Okay.
Man of few words. Hold on, General Hara, or Chris Tatum. Since the inbound traveler quarantine went into effect last Thursday, how many homeless people have arrived in Hawaii? Do we know that? And Daryl says, Daryl from HNN, we have gotten reports from at least 3 homeless people. They've gotten reports saying that at least 3 homeless people have showed up at HNL, and workers wrote the address of a homeless shelter on their form and sent them on their way. What is happening to those people?
So I know of at least 1 on Oahu that was put into the homeless shelter, the recently stood up homeless shelter, and there were 3 that went to Kauai, and all 3 were arrested. Okay.
Thank you very much. Dr. Anderson, another question for you from Kristen Concilio, Star Advertiser. Can you tell us how many private doctors have closed their doors amid the pandemic, and what is the DOH doing to help them stay in business?
We've heard anecdotal reports of a number of physicians who have stopped practicing as of late for various reasons. Some of them are not trained to deal with infectious disease. Others are having difficulty obtaining personal protective equipment. For those, we are working to be sure that they have the equipment they need to operate. We're worried as physicians may be leaving practice, particularly private practices, that it'll put more stress on our hospitals and our Primary Care Association is now looking to help to support the patients who don't have physicians available anymore to help them. In fact, we've reached out to them and are discussing with them how we can keep them in business so that they don't have to close their doors. They're a critical part of our healthcare infrastructure, and we need them to be there to help support the communities they serve. And we'll do everything we can to keep them going. Thank you.
Okay. Director Hara has a follow-up on that.
Yeah, I just wanted to add something from the previous question. So Governor Ige talked about those that fly in, if they don't have a place of lodging in Hawaii, that we turn them around and send them back. Unfortunately, we cannot do that by law because they didn't break any laws. So the individual would not be able to abide by the mandatory 14-day quarantine rule. And we're given an option. They can fly back. If they don't fly back, then those are the ones that get arrested.
Okay. Thank you very much, General. All right, I think, Dr. Anderson, we have another one for you here. This is from Ashley Mizuo. DOH says that the community spread cases cannot be pulled out and put on the map. separate from the travel-related cases because it would violate HIPAA. How many cases of community spread would we need to have to make a map that is community spread cases specific and not violate HIPAA?
I've never heard that HIPAA is an obstacle to doing that. But having said that, the maps that we have developed are in the early stages of development. We have listed all the cases there, whether they're cases that were associated with community spread or cases associated with travel. We will look to see if there's a way we can distinguish those without violating any personal protections that people have. Most of the cases we have are travel related. As you can see on the chart on my right here again, the orange sections of those bar charts are the community spread cases, those without travel histories. The dark blue which are the majority of the cases we have, are residents who traveled and became infected. And of course, when you look at the maps, you can assume that most of those cases are associated with travel.
Okay, thank you very much. Our next question is for either Mr. Rathel or Mr. Tatum. Will hotels also be willing to accept people who need to isolate, either due to positive tests or contact with a positive patient, group home residents who need to get out of crowded housing, or other non-first responder or healthcare populations?
Thank you for the question. So right now, the Hotels for Heroes is for the healthcare professionals, first responders, and emergency personnel. I know that DAIMA is actually working with all the hotels, and they're evaluating the opportunities and what they'll need, and I know that the hotels will all work with them to do what's needed.
Okay, thank you very much. Next question. Director Hara, I'm not sure you can answer this, but can you give a breakdown of National Guard members per county? We have Kay Howe asking this question from Maui News. Okay, General.
So my boss told me to come up here and answer that question. But so we're looking at approximately 54 to 57, depending on the county, of National Guardsmen ready to support. So each one, we have a company size, is what we're calling it. So each county has a company size element.
Okay. Thank you very much, General. Governor Ige, next question for you from Wendy Osher, Maui Now. Why wait until travelers arrive to determine if a traveler has a place to stay? Could that determination be made prior to boarding?
No, we don't have any way of enforcing. As I had said, the FAA said that airlines cannot discriminate anyone boarding an airplane.
Okay. Thank you very much. Dr. Anderson, this is for you from Eleni Gill, Civil Beat. When is Hawaii expected to hit its peak based on current modeling, and how many people does the state expect to die?
How long is this going to last? That's a tough question, but having said that, most of the curves that we've looked at, the projections at least, suggest that we're going to be looking at least a month until we actually reach our peak. And then we can expect the disease to tail off. It may be considerably longer than that. Time will tell as to how effective our mitigation measures are. One of the issues associated with flattening the curve is it can be extended a bit when you do that. That's generally considered to be worth the price, because you're not having so many people affected with serious illness that you can't treat if you can extend it a bit. But if the projections are accurate, we're looking at several months before we're going to start seeing the curve begin to drop, and where we can start thinking about relaxing some of the mitigation measures that have been imposed.
All right. Thank you very much, Dr. Anderson. Our next question comes from Eleni Gill, Civil Beat. This is for Brigadier General Kauivi or Director Hara. Could you clarify clarify what you mean when you say the National Guard will support law enforcement and security to enforce the governor's order. Does that mean restricting citizens' movements, such as roadblocks?
So depending on what the law enforcement agency on the county needs, we will assist them in that manner. So right now we cannot say for sure because we haven't gotten specific requests of all counties. We have some from Kauai, and we're able to assist them, and that's to maintain security checkpoints, in this case on Kauai.
Okay. Thank you very much. General Hara, this is for you. Daryl Huff, HNN. Will soldiers at airports be armed?
The answer is no. None of the soldiers or airmen will be armed on any other missions. That, of course, could change if the risk goes up. Then I'd make that determination on a case-by-case basis. But no one will be armed at this time.
Okay. It looks like we have one more from Daryl. General Hara. Oh, no, I'm sorry. This is for Governor. If the federal government continues to refuse to allow transfers to FDC, the Federal Detention Center, will you release them, or do you have a plan B to keep them in custody somewhere else?
As you may be aware, the court has appointed a special master to review each of individual and make a determination about whether it would be safe for them to be released. That's what we were asking for, that every individual should be evaluated on the risk to the community before they are set free.
Okay, Governor, one more question here for you. What is happening with RIMPAC? I believe that's in June or July?
You know, certainly I'm not exactly sure at what the schedule is of impact. I will be sending a letter to Admiral Davidson asking that RIMPAC be postponed until the COVID-19 situation here in the islands subsides.
Okay, thank you very much, Governor. Dr. Anderson, another question for you from HNN. Daryl says, you told us yesterday that the testing protocols may be modified to test more people who have been in close contact with positive cases, even without symptoms present. When will that happen?
We've begun to do that already. Health Department has been focusing on contacts who are symptomatic. But as we've noted, the increased evidence of pre-symptomatic infections, we've begun to look at those who were close contacts, even though they have not expressed symptoms. I expect we're going to continue to look to see if we can identify individuals who have been infected and are asymptomatic. But as it is, we're focusing on those individuals who obviously would be at higher risk. This whole question of whether you can transmit the disease if you're asymptomatic is still being evaluated worldwide, and I'm sure our policies will be adjusting to whatever the current knowledge and understanding is of that issue. But it is a significant concern, and another reason why people should wear masks when they're needed and avoid being too close to others.
Okay.
You should assume you are infected and everyone else is infected around you. Thank you.
Thank you, Dr. Anderson. This is for General Kauidi or Director Hara, HNN. What exactly will the role of soldiers be at the airports?
So our National Guardsmen will be at the airports to assist with the existing screening. First off with the temperature screening, and then they're working with the airports in case there are other types of screening assistance they need.
Okay. Thank you very much. Governor, you have a question from Rick Kwan, KITV. How do you feel President Trump is doing in handling the crisis? Anything else that he could do for Hawaii?
You know, we have been in close conversation with all of the federal agencies. FEMA Region 9 Director Bob Fenton is very familiar with the needs of Hawaii, and he has been very effective and responsive to our needs. The one area that we haven't received all of the things that we requested is personal protective equipment, and FEMA has in the last few days directed the states to pursue their own procurement. And so that continues to be a challenge. You know, we're committed to ensuring that we have the personal protective equipment to keep our healthcare community and first responders safe. We will continue to advocate and search for vendors that can allow us to acquire the equipment that we need.
Thank you very much, Governor. Director Hara, this is from Eleni Gill. Have any long-term care facilities, such as assisted living or nursing homes, received PPE? Anyone else? Okay. Mr. Rapel?
Our Emergency Preparedness Coalition is distributing PPE to a number of facilities across the state. This is being done on an as-needed basis. As the Governor has talked about, there are significant challenges in terms of acquiring enough PPE for the state of Hawaii. This is not only a national problem, it's an international problem. However, we are making decisions on a day-to-day basis, evaluating burn rates. So we are supplying PPE right now to hospitals, long-term care facilities, other facilities. We just shipped, for example, this morning, a batch of PPE to Hana to support the outbreak over there. So we are supplying and distributing supplies on an as-needed basis. It would be great if we had a lot more PPE, we could provide a lot more coverage, but there are decisions being made on a daily basis to do the best we can with what we have.
Thank you very much. Dr. Anderson, for you from H&N, the Health Department is releasing breakdowns on coronavirus cases by county, but there is no data on the ages of those who have tested positive. Can the DOH say what percentage of confirmed cases are under 65?
And when you look at our website, the next time you see it, probably tomorrow, you'll see a breakdown by age. Today's cases, for example, we had 34 cases. They were all adults. There were no children, no individuals under 18 years of age. And overall, we're seeing all age groups affected, possibly with the exception of the younger age groups, which have lower than expected rates of infection, or at least expressing symptoms. So we're seeing a distribution that's consistent with what we're seeing across the country, where a disproportionate number of older citizens are being seriously impacted, but all age groups are being affected. And as you look at our age distribution, normally the age distribution of the cases follows pretty much what our demographics are here. Thank you.
Okay, one more question for you, Dr. Anderson. This is from Eleni Sewell-Beat. How many infections have been confirmed among senior care homes or facilities? Any idea?
I wouldn't want to venture a guess. We can look into that.
Okay.
Thank you.
Thank you very much, Dr. Anderson. And with that, we'll have closing remarks by Governor Ige.
Thank you so much for joining us. I really wanted to remind everyone that the fight against COVID-19 is a marathon. We are at the beginning of April. Our extreme actions to isolate our community, to restrict travel from out of state, to restrict travel inter-island, is all focused on flattening the curve and ensuring that our healthcare system is not overrun by COVID-19 cases. We can only be successful if we work together as a community. Each and every one of us need to take responsibility for our actions. I've often said that we should all assume that we're COVID positive, and we should refrain from social interactions that could infect another. And we should all treat everyone else as if they were COVID positive. We need to keep social distances, stay at home, work at home. We should only be leaving our residents to acquire essential food and other materials. And other than that, we should be at home and maintain social distances. You know, I know that our community always comes together in crisis, and this is another challenge that I know that we can meet. It is so important for each of us to take responsibility. Take care of yourself, take care of each other, and most importantly, let's take care of our community. Thank you.
Governor David Ige giving us a lot of updates there today. One of the most important ones, get your calendars out. One more month to the peak, at least according to Director of Department of Health Bruce Anderson. One more month. Here we go. The partial activation of the National Guard was also mentioned today. 4 different units across, 1 for each county, 250 total personnel. We'll put a full list of the kinds of duties that they will be doing, but among the bigger things, assisting with airport screening and security, assisting with hospital security and the like, even disinfecting key places. Again, 4 Guard units of the National Guard activated for COVID-related support. Secondly, we do have to report a 3rd death in the state of Hawaii, COVID-related today. An elderly adult on Oahu hospitalized for several weeks. This is an older gentleman who had been in critical condition and life support after traveling to Washington State, and he has passed away. We believe that his description connects very closely with the 2nd positive reported case way back in early March. Our condolences. Overall, the numbers spiked another 34 today overall, most of them on Oahu, bringing the total case count to 319. 319 total statewide. 12,000 tests now have been done and growing. I'm going to tell you about some drive-through testing this weekend in a moment, but 12,000 tests done. We did learn there was another positive from the Pride of America cruise ship. Now, this is an idled cruise ship. There have been no active cruise passengers for many weeks, but a Pride of America crew member on the idled ship here at Honolulu Harbor did test positive. Tomorrow, you can expect to see a breakdown in age, according to the Department of Health. We'll know much more the age categories that all of these folks are falling into. Next, we do want to show you some of the drive-through testing options. If you are experiencing symptoms and you need a test on Oahu this weekend, here's where you can find them. Saturday, tomorrow, at the Waipio-Sakura Peninsula, 8 a.m. to noon. These will be handled by Premier Medical Group Hawaii. Again, it's not just get one if you wish. You still have to have the symptoms that display that you're eligible for that. And again, on Sunday, you can go to Kaka'ako Waterfront Park, corner of Ilalo and Cook Streets, queue up there, and that will also run from 8 a.m. to noon. And we will bring you all of this and more on all of our newscasts starting today in a half an hour on the KHON2 News at 4. I will see you then. Please take care, stay safe, and start to wear those masks. That became a CDC recommendation today, not just a county recommendation. Be safe, everybody. We'll see you soon.
This has been a special report from the KHON2 News.
We're a AAA family.
We found out about AAA insurance through a friend who had actually mentioned it a while ago. We ran the numbers and it totally worked.